It's time for part 2 of the musculoskeletal system. We are going to go over coding spine procedures, arthroplasty procedures, the arthroscopy technique, and the repair sections. I think it's important that you know your knee anatomy. There are 3 bones that meet to form the knee joint. The femur, which is the thigh bone, the tibia, which is the shin bone, and the kneecap, which is the patella. Inside the knee joint, there is articular cartilage. The ends of the femur and tibia and the back of the patella are covered with articular cartilage. This slippery substance helps keep bones from gliding together. 2 wedge-shaped pieces of meniscal tissue act as a shock absorber between your femur and tibia. Different from articular cartilage, the meniscus is tough and rubbery to help cushion and stabilize the joint. When people talk about torn cartilage in their knee, they are usually referring to the meniscus. There are 2 menisci in your knee, one lateral and one medial. It's important to know this. Please note it in your book. Bones are connected by ligaments. Don't get ligaments confused with tendons. Tendons connect muscles to bone, and ligaments connect bone to bone, as you can see in this illustration. Collateral ligaments are found on the sides of the knee. The medial collateral ligament is one on the inside of your knee, and the lateral collateral ligament on the outside. They control the sideways motion of your knee and brace it against unusual movement. Then you have your cruciate ligament. These are found inside your knee. These are intra-articular ligaments. Please make a note of that next to your ACL repair code. We'll go over this in more depth in a bit. They cross each other in an X-like fashion. One is in the anterior, so the front side of the knee joint, and the other, the posterior ligament, is in the back side of the knee joint. The bones of the shoulder are the humerus, the upper arm bone, the scapula, the shoulder blade, the clavicle, the collarbone, and the roof of the shoulder is formed by a part of the scapula called the acromion. There are actually 4 joints that make up the shoulder. And remember, a joint is where 2 bones join together. The main shoulder joint is called the glenohumeral joint. It is formed where the ball of the humerus fits into the shallow socket on the scapula. This shallow socket is called the glenoid. The AC joint is where the clavicle meets the acromion. The SC joint, sternoclavicle joint, supports the connection of the arms and shoulders to the main skeleton on the front of the chest. It's really important that you know what the rotator cuff muscles are in your shoulder. These are commonly injured and called different things. The rotator cuff muscles can be called the supraspinatus, which is at the top of the muscle, the infraspinatus, which is at the bottom, the subcapularis, and the teres minor. Now that we've talked about the shoulder and knee anatomy, we're going to talk about one of the most common procedures performed in the musculoskeletal system, and that is an arthroscopic procedure. I'd like for you to turn to the arthroscopy section. And at the beginning of the musculoskeletal section, look at your table of contents. Look for arthroscopy and turn to the beginning of that section. In the illustration, you can see this is what an arthroscopic procedure looks like. They're using a tool to look into a joint with a camera to perform procedures. This is minimally invasive and is a better alternative than opening up the patient. Arthroscopy, also called arthroscopic surgery, is minimally invasive surgical procedure on a joint in which an examination and sometimes treatment of damage is performed using an arthroscope, endoscope, that goes into the joint through a small incision. Look for words that indicate an arthroscopic procedure were done. These could be words such as arthroscopy, portal, or cannula. A portal is a hole where they are going into accessing the joint, and a cannula is a tool that is commonly used with arthroscopy. Write these in your book near this section. We're going to talk about the shoulder arthroscopy section. Turn to that in your books now. There's common codes I need you to write some things next to, so let's get started. 29806, find that code. It says arthroscopy shoulder capsulorrhaphy. This can also be called a Bankart repair or a labral repair. So write those two words next to the code. 29807 is a slap repair. A slap repair stands for superior labral anterior to posterior. That's how they're repairing the slap lesion. 29822 is a limited debridement. A limited debridement is when one structure in the joint is debrided. So if they just debride the rotator cuff, that's going to be considered limited. A biceps tendinotomy is also considered limited debridement. So write those next to this code. 29823 is an extensive debridement. In the opposite of the limited, it has to be two or more structures or areas of the shoulder that have to be debrided. So if they debride the rotator cuff and the labrum, that's an extensive debridement. 29828 is a biceps tenodesis. Now remember, desis means fusion repair. Do not mistake a tenotomy for a tenodesis. A tenotomy means cutting into, is when they are releasing the tendon. A tenodesis is when they are releasing the tendon but repairing it back together. So if they say they do a tenotomy, that's going to be coded with that debridement code we talked about earlier. 29824 is a distal claviculectomy, also called a Mumford. Commonly on your distal clavicle, bone spurs will appear. When these are excised, this is not considered a distal claviculectomy Mumford. This is a debridement. So make sure you write this next to this code in case you try to get tricked on this. Now let's talk about knee arthroscopy procedures. Let's look at meniscectomy procedures. Look at codes 29880 and 29881 now. I need you to point out in these codes in your book where it says or and and. 29881 is a knee arthroscopy medial or lateral meniscectomy. That means only one of the menisci were resected. 29880 is when both the medial and lateral meniscus is resected. Remember, ectomy means excision, so this is taking off the meniscus. Commonly, it will say something like, we debrided or we shaved the meniscus. 29887 is a chondroplasty. A chondroplasty is when the surgeon will shave articular cartilage that is damaged. Do not code a chondroplasty with 29881 or 29880. Make a note of that. 29879 is a knee arthroscopy abrasion arthroplasty, sometimes called abrasion chondroplasty. This is when they are using a pick or microfracture to go down to bleeding bone. You will see the terms abrasion chondroplasty, microfracture, drilled with a wire to the bone, or down to bleeding bone. These are good indicators that this code should be used. We talked about meniscectomy procedures. Now we're going to talk about the opposite, which is a meniscal repair procedure. The same as the meniscectomies, you have two codes. One for the medial or lateral meniscus repair, and one code for the medial and lateral meniscus repair. Make a note just like you did on your meniscectomy procedures for these codes. 29888 is a very common procedure. 29888 is an arthroscopically aided ACL repair. The ACL stands for anterior cruciate ligament. Part of this procedure is performed open. That's why the code descriptor says arthroscopically aided. The graft harvested in this procedure is included in the code and not coded separately. Now let's talk about arthroplasty procedures. Remember, arthro means joint and plasty means reconstruction. So this is where they are reconstructing the joint. An arthroplasty is a surgical procedure to restore the function of a joint. An artificial joint, called a prosthesis, may also be used. When the entire joint is replaced, it is called a total joint replacement. You have a total knee, 27447, a total hip 27130, and a total shoulder 23472. Those are your most common total arthroplasty procedures performed. There are others for other joints in the body. Now we're going to talk about the spine. The spine is broken up into sections called the cervical, the neck of your spine, the thoracic, the middle part of your spine, and the lumbar, your low back. And then you have your sacrum. The cervical, your neck, goes from C1 to C7. The thoracic portion goes from T1 to T12. The lumbar portion goes from L1 to L5. And the sacrum goes from S1 to S5. It's important for you to write that down in your book at the beginning of the section. The anatomy of the spine is the cervical, your neck, is the main function of the cervical spine to support the weight of your head, about 10 pounds. The 7 cervical vertebrae are numbered C1 to C7. The thoracic part of your spine is your mid-back. The main function of the thoracic spine is to hold the rib cage and support the heart and lungs. The 12 thoracic vertebrae are numbered T1 to T12. The range of motion in the thoracic spine is limited. The lumbar, low back portion of your spine, the main function of it is to bear the weight of the body. The 5 lumbar vertebrae are numbered L1 to L5. These vertebrae are much larger in size to absorb the stress of lifting and carrying heavy objects. And then you have the sacrum. The main function of the sacrum is to connect the spine to the hip bones. There are 5 sacral vertebrae, which are fused together. Together with the iliac bones, they form a ring called the pelvic girdle. Coccyx region. There are 4 fused bones in the coccyx or tailbone that provide attachment for ligaments and muscles of the pelvic floor. There are some terms you need to know before we start coding in the spinal section. A spinal segment looks like L1 to L2. That is considered a segment. A vertebrae is just L1. Spinal procedures are coded from the musculoskeletal system and the nervous system because there are nerves that run through the spine. There are a lot of guidelines in the spinal section. I encourage you to read them and highlight them. Let's talk about arthrodesis procedures and how these are coded. I think you should write these steps down in your book as well. First, code by the approach. Was it done anterior or posterior? Then, was a bone graft used? What type of graft was harvested? Finally, code for the instrumentation that was implanted. Was it segmental or non-segmental? I'm going to let you try this on your own. You might not get it right at first, but we'll do it together after. Let's look at example 1. The surgeon is performing a posterior arthrodesis of the L5 to S1. A autogenous iliac bone graft was harvested through a separate incision. Pause this recording and find your code now. You should have got 22612 because the procedure was done posteriorly and 20937 for the graft. Now remember, grafts are found in the general section of the musculoskeletal chapter. Now let's try one a little more complex. The surgeon performed a posterior arthrodesis of the L4 to S1. A autogenous iliac bone graft was harvested through a separate incision and a pedicle screw fixation was performed. Pause this recording and get your answers. You should have got 22612, 22614, 22842, and 20937. The 22614 is because there was an additional segment done. If you noticed, the question said L4 to S1, but L4 to S1 would be L4 to L5, L5 to S1. Think about that for a second. That's why we had to add that add-on code. 22842 is for the instrumentation of the screws. And 20937 is for the bone graft. Like I said before, the nervous system is also used to code spine procedures. Let's look at 63020 and 63030. These are laminotomy, hemilaminectomy procedures. Hemi means partial. This is usually done for the diagnosis of a herniated disc, and it includes decompression of nerve root, fasciectomy, fornotomy, and excision of the herniated disc. You can write that around these codes. Don't get this procedure, 63030 or 63020, confused with a laminectomy, 63047. A laminectomy is not a partial hemi. A laminectomy is usually done for stenosis, not a herniated disc. Now that we've talked about the spine, let's talk about a few other procedures before we wrap up this section. Ankle arthrodesis. Remember, an arthrodesis means arthro, joint, and desis, fusion. So it's a fusion of a joint. These are commonly done in your ankle foot area. A pantalar arthrodesis is a tibiotalar, subtalar, talonavicular, and calcaneocuboid joint arthrodesis. Write this down in case this is an anatomy question. A triple arthrodesis is the subtalar joint, the calcaneocuboid joint, and the talonavicular joint. Here's a picture of an arthrodesis done in the foot for immobilization of the adjacent bones. As you can see, two bones are being fused together with one plate. And that's all for the musculoskeletal system. Make sure to study before taking your final quiz.